heard about the Grady laser after having used a couple of the other excellent ones, and lo and behold, the little puppy works really, really well. It's helping probably at least 80% of my patients, and that's, you know, if you go to Las Vegas with an 80% chance of winning, that's pretty darn good.
She had a ligament, detachment, about 2 years ago, and after a year of that, she still wasn't using her leg, so the doctor decided to do the laser treatments when it became available. And now she is. She's hopping all over the place and jumping up on beds that she didn't jump up on for a long, long time. And she's happier. You can tell she's a lot happier. We did the physical therapy and it didn't help as much as the laser did. The laser made her normal again.
So obviously the laser's just light, and anything in the way is going to interfere. So there are some lasers out there that I tried, by the way, that you actually hold the laser up high, and I found that to be fine for the superficial wounds, things that you can actually see. But when it comes to reaching in deep, I find you have much better help if you're actually in contact with the surface, because the less reflection or refraction you have, the better it's going to reach where you're trying to heal.
She's having problems with her discs, her spine. We tried acupuncture. She was a little, they didn't really want to do surgery, and we thought that it was, we heard that it was, you know, an alternative to kind of like acupuncture, alternative medicine, and we wanted to try it. If we don't come for a long time, she starts falling a lot more, she trips a lot, she has a lot of trouble getting up. When she's in pain, she doesn't really want to get up. So it has been very beneficial for her, I think.
When you're putting those drugs in the body, you're basically just trying to relieve inflammation. The problem's still there. With a laser, you're actually trying to heal tissues inside. It's not just covering up the problem. So the laser being wonderful for healing, you can use it on many different conditions, from skin wound, helping skin wounds heal faster, to ligament inflammation, tendon inflammation, degenerative joint disease.
Whiskey was screaming in pain one day, and he was having a hard time moving. So we took him in, and the Dr. Baltrans prescribed him with some medication. He was doing a little better. The pain seems to go away for a while, but then I think a few weeks later it starts again. So that's when Dr. Baltrans recommended the laser treatment. And we were doing 3 times a week, and then 2 times a week, and now he's down to 1 time a week. He moves a lot better, and he feels more comfortable, and I just feel that I have my best friend back.
And so the first image that comes to a person's mind is, you know, the Jedi laser or cutting laser for surgery, so you're worried that it's going to hurt the patient. I tell them, no, there's lots of different frequencies of lasers. This is a healing laser. All we're going to do is help the tissues heal with it.
Peanut here had both ACLs replaced on both her knees, as well as hip dysplasia. Felt that it was an opportune time to go ahead and try it and see if it does improve her quality of life. Nowadays she's a little bit more apt, and I do discover up on top of the sofa, which sort of indicates that she is a little bit more agile, more comfortable to do so. She definitely is improving from the laser treatment.
My technicians are doing 90% of the lasers for me now. It's not like you have to wait months for results. You see the difference within a week. Some of them within the first treatment. So lasers definitely going to be part of this practice for a long, long time.